Therapy for first responders. Would you agree that first responders commonly face stressful experiences on the job? Most first responders would. And yet, many also feel that talking about their reactions to these stressors with a counselor or therapist means they're admitting to being damaged, unfit for duty, or having problems, or that they'll be put at risk by exposing their deepest, darkest vulnerabilities. In reality, stress reactions are simply biological signals designed to nudge you in the direction of beneficial change. They're a sign that something's going unaddressed, a call to action. They can injure you in the same way that physical stress does. And when they do, and when they accumulate or occur because of strong events in your life, your personal maintenance may need some assistance from a trained professional. Think of it this way. You do maintenance on your equipment at work daily, and if your check engine light comes on in your personal vehicle, you may need help getting it checked out and repaired. It makes sense to take care of your body and mind in the same way you take care of your equipment. Most intense situations at work benefit from focusing on what needs to be done in the moment rather than on your stress reactions and emotions. But in the long run, research shows that first responders have fewer long-term stress injuries when they make time to reflect upon and integrate their reactions and emotions. The following firefighter analogy may be helpful for people processing difficult emotions. When firefighters arrive on scene to a working structural fire, they don't ignore the fire in hopes that it will go away or get better on its own. They employ the most effective strategies to put it out. When it comes to emotions, just like with a fire, while it may be tempting to ignore them and hope they'll go away, in the long run, there are more effective strategies that can better help to reduce suffering. Good therapists, whether they're licensed counselors, psychologists, or social workers, can give you the time and structure to do this. They can also help you identify blind spots, have more patience with yourself, see how your thoughts affect emotions and behaviors, better regulate your emotions rather than suppressing or being overwhelmed by them, effectively problem solve and buffer stress in your life, and get back to functioning better in all areas of your life. Therapy can also help you get to the roots of your problems, which may be broader or older than what's been happening on the job. A good therapist will encourage you to be patient, curious, and persistent with the treatment until you feel and function better. Everyone has a different rhythm with treatment, depending on many factors. There's no one-size-fits-all path. Some people have the time, motivation, and bandwidth to tackle it quickly, while others take years or decades to address and integrate experiences, thoughts, and emotions. Each person will find the path that works best for them. If you decide to try therapy, checking with your department's available resources or employee assistance program may be a good place to start, but the number of sessions may be limited and EAP providers may lack the necessary expertise for your concerns. So you may have to look outside of the EAP program if you need more specialized or extended support. Check your department's behavioral health resources or ask first responders that you trust for help finding a recommended therapist. You may have to talk with a few before you find somebody who specializes in what you need and makes you feel a sense of connection, trust, and safety. Even if you end up having to pay for some or all of the treatment, remember that it can have a positive ripple effect in all areas of your life. Finding a good clinician can sometimes be like finding the right pair of running shoes. There's no one brand that works for everybody, and sometimes you have to try on a few before you figure out which one is the best fit for you. When looking for the right clinician, it's important to find somebody that you feel comfortable with. It's a bonus if the clinician understands first responders. But there are more first responders who need clinicians than there are clinicians who understand emergency responder cultures. So prioritize finding a clinician that you connect well with over one who claims to specialize in first responders. If they don't know your first responder culture, you can increase their understanding by sharing the common stressors and aspects of your work with them, like troubles with sleep rhythms, organizational stressors, poor leadership, or relationship challenges. If they're a good listener and you feel you can share your unsharables with them, these are more important to the foundation of therapy. Lastly, if therapy has been helpful to you, the power of sharing how it's helped you can change your coworkers' views of therapy and open up conversations. In the words of Battalion Chief Dina Ali, a couple of years ago, while teaching a peer support class, one of our peers introduced herself, shared her story, and said, "Therapy is awesome." I'll never forget how quickly making that declaration changed the entire group's view of therapy and opened conversations. Several in class then shared their experiences with therapy, and suddenly therapy became supported rather than shameful. When people share their positive experience, they have the potential to positively change more lives across the workplace.